SPMs, otherwise known as Specialized Pro-Resolving Mediators. Now that's a mouthful. Let's talk about what SPMs actually are. Specialized Pro-Resolving Mediators are a group of lipid molecules, in essence they're fat, derived from the essential omega-3 fatty acids EPA and DHA. So, you haven't taken my crash course on omegas. I encourage you to go back and do that after the show. Omega-3s produce chemicals called EPA and DHA, and SPMs are basically byproducts of these two molecules. Now here's the technical component of how they work. They switch macrophages from a pro-inflammatory state to a pro-resolving state, facilitating the clearance of dead cells and debris at inflammation sites, thereby promoting tissue healing and a return to homeostasis. Now, what does that mean in English? They basically help change your white blood cells from the type that secrete chemicals that do damage to the type that come in and clear out the damage so that your body can heal and repair the damaged site. So for those with chronic inflammation, SPMs act as a brake signal to stop excessive immune responses. They're currently being investigated as potential therapeutic for a variety of inflammatory diseases due to their ability to limit inflammation and promote repair. So in essence, they're fats derived from omega-3. So kind of classify them in your mind as a type of nutrient because you have to eat omega-3s. Omega-3s are essential fats that you cannot obtain anywhere else except through food or supplementation. So what does SPM, what do they do? What are their functions? Number one is they resolve inflammation. We'll get into this in a minute. They help tissue regeneration and repair by clearing debris. Again, they move out. If you can imagine a construction site, imagine bulldozing down an old house. That's inflammation. Now imagine you're trying to build a new house, but you need to remove all that damaged debris and material you just tore down. That's tissue repair and regeneration, and that's what SPMs help to do. Now they also help regulate the immune system, especially they draw in certain types of white blood cells at certain components or times during inflammation, and they also have anti-pain or analgesic effects. Now I think before we dive too much deeper, we should talk a little bit about inflammation as it relates to these molecules. So when we're talking about inflammation, generally speaking, in the initiation phase, there's some type of assault or some type of an injury. In essence, this could be a physical damage. This could be a pathological damage caused by a microbe like a bacteria or a virus or a parasite or a fungi. This could also be diet or lifestyle-induced inflammation like behaviors such as smoking or alcohol consumption or the consumption of junk food. So any of these things that will initiate inflammation, you go through an initial phase. This phase, you can see delineated by green. If it's normal, we have the inflammation, and then through a period of time, and this varies depending on the extent of the injury, the acute inflammation resolves and the tissue returns back to normal. So imagine you got a cut, the cut clots, and then it scabs over, and then the scab falls off and you're forming new skin and everything is better. That's the way we want to think about inflammation. But what happens to many is they have an assault, and instead of having this nice acute response where they resolve the issue, they have a different kind of curve where the assault doesn't stop. And so you can see how it kind of curves here in this red line. Think about each one of these as another assault. In essence, you know, if you get a cut, hopefully you're not just stabbing yourself with a knife. It was an accident. But when it comes to chronic inflammation, what happens is people have behaviors that contribute to tissue damage repetitively over and over and over again. And so instead of the inflammation resolving the way that it should and the body healing the way that it should, the inflammation remains on. And so your immune cells keep coming into the area where the damage is occurring, and they're releasing chemicals that cause damage because that's their job. So if we look at kind of a more complex map of inflammation, you can see here the initial injury right here in this site, and we'll blow this up for you. And so what happens is this initial injury is you get all these different types of cells from your immune system and nervous system penetrating into the area, and their job is to basically it's to release chemicals that clear out the damaged tissue. And then you have a second phase of that. So once you have all these different cells come in here and release all of their chemicals and basically dissolve the damaged area, then you have specialized types of cells that come in, like little Pac-Men, that scavenge the area and chew up all of the debris. And this process, so we're not going to get too technical in here, but this process is stimulated, you can see here, by SPM. And so that's what this term phagocytosis means, is your SPMs are basically stimulating a specialized type of white blood cell that comes in there after all the damage has been done to chew up that damage and remove that damage. And that's important because in order for the body to finalize healing and repair, you've got to remove the damaged tissue and the debris. And so once that's done, you can see with SPMs, you get tissue regeneration. If the damage is bad enough, you get a scar. Like if you cut your skin bad enough, it can scar. Or if the damage is prolonged enough, you can get scar tissue. But as a general rule of thumb, we get resolution of the inflammation. So if you look at the initial injury as step one, then you have pain that occurs as a result of that. But through this process of white blood cells, different types of white blood cells coming in, that's called the transition phase, where again you're breaking down all the damaged material and you're Pac-Manning that stuff out of there so that you can start healing. So we got initiation, transition, and then we have resolution, and then after resolution everything goes back to normal. That's the way inflammation is supposed to work. But if the injury is repetitive, if the thing that's causing the injury continues to be present, I know a lot of you may be thinking about like a physical injury, but I'm talking about the chronic injury of consumption of something like gluten, right? So gluten causes inflammatory injury. Other food allergies can. Environmental toxins can cause biochemical cuts, so to speak, and create inflammatory injuries. We know there are three primary triggers that can create biochemical injury that are not physical. So we could use the physical injury as an example, but we also have food, especially processed food. We have microbes, microorganisms, and we have environmental toxins, heavy metals, potentially mold toxins, other pollutants, things like alcohol, cigarette smoke. These are all things that can do that injury. So if these things aren't going away, then this injury never leads to a final resolution and homeostasis. You just stay in this zone. So like you're stunted and you stop right here. And so all these different types of cells are just releasing their toxic chemicals, causing inflammatory responses that lead to pain and dysfunction. And it's SPM, you can see right here, SPM, Specialized Pro-Resolving Mediators, that allow for this chaos of inflammation to move forward in this process to resolution and then subsequently to full healing. So it's important to know that inflammation is not bad, it's not evil, it's a normal part of human physiology. What becomes bad and evil is if it becomes chronic, because the assault doesn't go away. And again, microbes, toxins, foods are all potential reasons why people can develop chronic inflammation. Certainly there are other lifestyle factors that play a role in it: lack of sleep, lack of sunshine, sedentary behavior. All these things can contribute to inflammation. Even emotional traumas can drive inflammation as a process. So if we look at this diagram, you can see here the actions of SPMs, or Specialized Pro-Resolving Mediators. So if there's acute inflammation, not a big deal. This is like your acute trauma, your acute injury. SPMs, if present, if you have plenty of SPMs, will lead to a resolution and to a homeostasis, which is a final healing and return to function. Now, if you have chronic inflammation here, this will lead to fibrotic tissue formation, scar formation, and persistent inflammatory problems like chronic pain, tissue, and organ injury. Now, even if you have SPMs, and you remember your body makes SPM from omega-3, so the byproduct of omega-3 are several different types. I'm simplifying it here, but several different types of SPMs, and the job of SPMs is to resolve inflammation and damage. So if you're devoid of omega-3, if you're not eating enough of these in your diet, then obviously you're not going to have enough of this. But if you're chronically inflamed, you're also, keep in mind, you're going to burn through these. Your body is trying to resolve inflammation. That's part of what it does innately, intelligently. It's trying to resolve that. But if the chronic injuries don't stop, you burn through your SPM. You burn through your ingredients, and you can become deficient. As a matter of fact, some studies show that women make more SPM than men. And this is possibly one of the reasons why they tolerate pain a little bit better than most men do. But nonetheless, chronic inflammation, you can see, can lead to tissue damage, can lead to chronic pain. But if you have adequate SPM, your body can stimulate the resolution of that problem. Now, some of the diseases that we know can be caused by chronic inflammation and lack of SPM are listed on this diagram. So these, you can see down here, these studies taken, this diagram is based on animal studies predominantly. So in vivo animal diseases, SPMs not only control classic and non-resolving inflammation conditions, but also reduce collateral damage such as tissue and organ injuries, chronic pain, and tissue fibrosis. They are normally active in picogram to low nanogram quantities, that is 100 to 1,000 times more potent than widely used classic NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs. This is what doctors commonly prescribe, like ibuprofen, which ibuprofen's over the counter, but Celebrex is another example, naproxen. These are examples of NSAIDs commonly used to what? To block the inflammation. So what an NSAID is doing is blocking the inflammation. It's not helping the body resolve to go on to healing. It's just blocking the inflammation, which is going to lead to a reduction in pain, but not a resolution of the problem. And that's why people with chronic inflammatory conditions like arthritis and cancer and diabetes, etc., can't just take ibuprofen or Celebrex and the problem goes away. Because generally the assault on the body, it continues, and all the NSAID's doing is blocking the body's perception of inflammation and pain, but not actually resolving it. So at any rate, you can see a number of different diseases. So myocardial damage, so damage to your heart, to your kidney, to your cornea, that's the eyes and the retina, the spinal cord, the lung, and the liver. Neuropathic pain, fibromyalgia, cancer, and arthritic pain. And then down here you can see as well colitis or inflammatory bowel disease, arthritis, gum disease, that's periodontitis, neurological disease, autoimmune conditions, cancer, cardiovascular disease, obesity, lung, kidney, and liver damage and scarring can all occur as a result of not resolving the inflammatory cascade appropriately. So chronic inflammatory response that doesn't resolve can damage your tissues. This has been shown in multiple animal studies, so we've got quite a bit of data in animal studies on the inflammatory damage that not having SPM or chronic inflammation will contribute to. Now, if we look at this diagram, you can see some of the effects of SPMs in general, and I'll walk through some of these. They inhibit. So some of this is a little probably Greek if you haven't had physiology or pathophysiology as a background in your education, but they inhibit a type of cell called a neutrophil. And what a neutrophil is it's a cell, a white blood cell that contains all these little granules in it. These little granules are proteins that are spit out of the cell. They spit out of the cell, and what they do is they degrade the tissue around it. So they're basically breaking down that damaged tissue. So neutrophils come into that area, they spew out their contents to basically dissolve the damaged tissue to help try to start removing it out of the way. SPMs inhibit this once it's happened enough. You don't want this process to continue indefinitely, because if it does, then tissue damage continues indefinitely. So SPMs lead to a resolution of this stage in inflammation. They also promote monocyte migration. Monocytes are these little Pac-Men I was telling you about. That this enhances this phagocytosis. Is basically it's these monocytes chew up all the damage that these neutrophils created. So if this is step one, kind of think of this as step two. First, you come in, spew out all the chemicals that basically break down the damaged tissue. Then the monocytes come in, and then they chew that stuff up and move it out of the way. The other things SPMs do is they inhibit interleukins. Interleukins are inflammatory chemicals that can continue exciting the inflammatory process. So SPMs inhibit these guys. Again, what's the goal of an SPM? It's to resolve the inflammation. They also increase something called NK cell-mediated eosinophil apoptosis, meaning these are specialized types of cells, white blood cells, called natural killer cells. Natural killer cells help to induce the death of eosinophils. And if you know what an eosinophil is, it's a type of cell, a white blood cell, that releases histamine. And histamine is a very inflammatory, excitatory chemical. So it's very similar to the stuff that neutrophils release. And so again, SPMs help stop that from continuing to happen. Then on the other side, so these are all parts of things that they work as far as directly with some of your white blood cells. But then on this other side over here, you have that, you can see it promotes memory B cells. Now, memory B cells are responsible for making antibodies. So if you've ever heard of antibodies, if you've ever heard your doctor talking about whether or not you had an antibody to a certain disease, antibodies are good. We want antibodies. Antibodies are protective. So if this was, if this inflammation was caused, for example, by a viral infection, we would want the promotion of antibodies. We would want this to occur because this would give us future protection from that virus. So SPMs help to kind of schedule the immune system to make antibodies to protect itself in the future. They also inhibit this chemical called TNF-alpha, which is a very inflammatory byproduct from white blood cells. TNF-alpha, tumor necrosis factor alpha. They also inhibit other kinds of interleukins from dendritic cells that are going to cause more inflammation and the persistence of a type of white blood cell tracking into the area that can stimulate autoimmune disease. So if these things are not done, let's say these things are being blocked, what ultimately ends up happening is you get the development of autoimmune type problems, because by blocking these different types of chemicals, especially Th17, by blocking them, you resolve the inflammation. By not blocking them, they contribute to persistent inflammation that can lead to an hyper-responsive or an overreactive immune system, which is generally what we call autoimmune disease. So these are just, again, chemical functions of SPMs. Now, let's make it make better sense. Let's make it easier. A little less chemistry. This is from Harvard, anti-inflammatory molecules in a sampling of their demonstrated benefits. So earlier I was saying that we get SPMs, which are here. The primaries are here. These are SPMs. Protectins, resolvins, mucins. These are all kinds of SPMs. So think of these as types of SPMs. They're derived from these two omega-3 fatty acids. So if you're eating enough omega-3, in the case of omega-3, it's cold water fish, ideally sardine, mackerel, anchovy, salmon. You can see here some omega-3 in algae, as well as in cod liver oil for those of you that may be supplementing with cod liver oil, or omega-3 supplements. This is one of my top supplements in my top 5 list that I think people should take. I mean, unless you just love cold water fish, but even if you do, the toxicity, the metal toxicity risks of eating large quantities of fish can become problematic. But supplementation or food gives you a good source of EPA and DHA. And actually, grass-fed beef would be on this side too. Because grass-fed beef does contain omega-3, so really should be on this side of the equation. And then from these omega-3, EPA, and DHA, we make these different SPMs, and then look at the disease associations. Now, these diseases listed here, some of them have been studied in humans, but most of them to date have been studied in animals. This is an area of ongoing research. Researchers are trying to better elucidate the therapeutic benefit of giving SPMs to patients to help resolve these chronic inflammatory conditions. But a lot of different diseases here. As I showed you on the last page, from atherosclerosis all the way down to retinopathy, Alzheimer's, asthma, stroke, neurodegeneration, arthritis, etc. I won't read it to you, but all conditions that we need SPMs to help to resolve. And then we have another type of, this is also a type of SPM over here, but this one is derived from arachidonic acid, which you can get plenty of that from beef, chicken, fish, and eggs, so animal foods. And then you can make these chemicals called lipoxins that have more of an anti-inflammatory effect against asthma, inflammation of the colon, corneal disease, cystic fibrosis, eczema, neuroinflammation, and periodontitis. So SPMs, very important in their role biochemically in the human body to help resolve inflammation. So if you look here, this was published in Journal of Functional Foods. You see where they're researching potential disease resolutions by administering these types of SPMs. And so this is kind of a synopsis of some of the research. You can see the lipoxin has been studied in animals to reduce colorectal cancer, diabetic problems, kidney disease, hepatocarcinoma, which is liver cancer, arthritis, and papillomas. Then we have also in animal studies Parkinson's, atherosclerosis, ischemia of the heart, arthritis, diabetic wounds, and cancer. And then Maricin, this other SPM over here, Alzheimer's disease, obesity, atherosclerosis, progression in rheumatoid arthritis. And then Protectin on the end over here in animal studies has been shown to be beneficial in diabetes. Now, from a human perspective, we know pancreatic cancer. Now, this is not me telling you if you have pancreatic cancer that you need to go take SPMs. It's a conversation you need to have with your doctor. But we do have human cell studies showing that lipoxin can reduce the aggressive nature of pancreatic cancer and its ability to metastasize. We also know arthritis, osteoarthritis, and Alzheimer's disease in human cell lines and in humans. There's studies now, there's now been clinical trials in humans on arthritis where resolvins are very, very effective and helpful at reducing pain, improving quality of life. And I'll show you some of that here in just a moment.